Missing a tooth, most patients ask us this one question: should I get a dental bridge or a dental implant? Both options are effective ways to replace a missing tooth, but they work quite differently. A dental implant replaces the entire tooth structures, including the roots. A small titanium post is placed into the jawbone, and once it heals, a crown is placed on top. A dental bridge, on the other hand, fills the gap by using the neighboring teeth as support. The teeth beside the missing tooth are reshaped and a connected crown structure is placed to bridge the space. One key difference is that an implant stands on its own. A bridge, however, requires the neighboring teeth to be reshaped so the crowns can support the bridge. This process can weaken otherwise healthy teeth and may increase the risk of decay over time. Another important consideration is bone health. As implants replace the tooth roots, it helps to stimulate the jawbone and reduce bone loss over time. A bridge does not replace the root, so the jawbone in that area may gradually shrink over time because the tooth roots is no longer present. In terms of durability, both dental implants and bridges are designed to be long-term solutions and can last many years with proper care. The treatment process is also different. Implants involve a minor surgical procedures and require healing time before the final crown is placed. Bridges, on the other hand, are typically faster to complete and do not involve surgery. In terms of cost, implants usually have a higher upfront cost due to the surgical component and materials. Bridges tend to be more economical. So which option is better? It really depends on your oral health, bone conditions, and overall treatment goals. Come visit us at i.Dental and we'll guide you towards the most suitable solution for your long-term dental health.